You can often hear patients say, my third vertebra isn't displaced. There's no displacement there at all. And what does that actually mean? What do people mean by that? And often even doctors themselves, manual therapists too, in order not to explain too much or overload the patient with terminology and all this complexity, they say that they've corrected a displacement, but in fact, it's not the displacement that's corrected, it's the fixation. Fixation is a functional block. A functional block is a restriction of joint mobility, meaning it doesn't actually move anywhere, it just sort of gets stuck in one of its movements. Normally, each joint moves along a certain trajectory. For example, a vertebra moves relative to another vertebra using these intervertebral joints. And this movement happens thanks to the muscles. And when one muscle doesn't work properly and another one has shortened, the movement kind of happens only in one direction. Or, for example, it happened in one direction and stayed that way. It stopped in this position. And the purpose of the manipulation, well, what does it mean to put it back in place? This simply eliminates this functional block, shifts it in the other direction. A therapist gives it a thrust, and with this restores movement in the joint at the angle where there was no movement. There are cases when, well, for example, many people, even doctors of other specialties, many neurologists, are afraid of manual therapists. And they tell stories like this about how someone had their neck twisted, for example, or there are other cases, like when someone performed a manipulation and cut the vertebral artery. Of course, I haven't encountered such cases myself. I haven't even heard stories from someone who said it happened to someone they know, but I have heard those things. So why does it happen that a person can be harmed through manipulation? Because, as a rule, this is done either by people who do not have a manual therapist's education or who have it by mistake. Or who have made a mistake, let's say, right? Or maybe the person just isn't skilled, but for some reason they are working in this profession. In general, every joint has a certain angle of movement, and each manipulation should be done at that angle. There are manipulations that doctors learn, the basic manipulations. When a manual therapist is just starting out, the first group of manipulations they learn, they are the simplest, and they are not selective for each joint. That is, at that stage, he is just learning how all these joints move, how the biomechanics of movement work. And the very first manipulations on the neck, the ones everyone is afraid of, are those with rotation, manipulations involving turning. At the same time, it's the easiest, but it can also be the most traumatic, of course. That is, in this case, it's impossible to choose which joint the manipulation will affect. But even if you do it technically correctly, if you correctly sense which joint has restricted movement, it's basically safe. Another issue is that some doctors still struggle with the manipulation technique itself because there are several phases to how it should be done correctly. That is, first you need to bring the joint to what's called pretension, meaning you need to move the joint fully and feel that restriction, and then continue moving the joint at the correct angle. If you use the wrong angle, even slightly, you can cause a minor injury, overstretch the ligaments, or cause swelling. Or if you make this manipulative thrust too strong, you can, of course, damage anything there. And often, that's the main mistake in manipulations. The first thing is the wrong angle, doing it at the wrong angle, and the second one is the manipulation technique itself. That is, the correct technique is to bring it to pretension, feel the movement restriction, and then make a sharp, short manipulative thrust. And this manipulative thrust, that comes with experience. For each joint, you need to choose the force and amplitude of this manipulative thrust. Of course, all of this comes with experience. It's all learned through practice. For example, I myself had such a case when I just started working as a manual therapy doctor. There were times during the workday when us, therapists, would remove each other's blocks. So, for example, I would say, crack my neck, do a neck manipulation for me, to my colleague, and he would gladly do it for me. It was great, until one day he said, "You know, I think I'm not fully removing your block. Let's try something different. Go lie down at the edge of the couch for me." So he had me lie down so that my head was hanging off the edge. And then he did this manipulation with rotation, with a turn. And oh boy, he really gave it a good twist, did it thoroughly. I felt that something really cracked even more after the usual manipulation. Something cracked. I thought, well, maybe that's for the best. And about 15 minutes later, I started having terrible pain. And it's not in my head and it's not in my neck, but somewhere between them, right where the head connects to the neck. Right in the place where there are short neck extensors. So it was this terrible pain. It was really hard to endure, obviously, and neither steroid drugs nor any other painkillers helped, so I just had to endure it. So apparently, because of this excessive rotation, because of this excessive turning, he must have torn something in there. Well, that's how we learned. We practiced on each other, experimented, that's it. Then, for a couple of years after that, his manipulation would remind me of itself from time to time. Meaning that later I was repairing the damage, but the short extensors themselves were already torn. They were slowly healing, the joint capsule itself, and I also had to restore the movement of the first vertebra. But on the other hand, well, now he and I both know that it's not the right approach. And we kind of realized that we needed to learn something else, other techniques. And on the other hand, if you have to do them all the time, like if, for example, you remove a block and it forms again, that means your joint isn't moving. It's good, of course, if you constantly make it move passively, but it needs to move actively. So that your own muscles fully use this range, fully use the range of your joints. So that everything is comprehensive. And like this. Now you know all this. Now you understand all this. But when you go to a manual therapist for treatment, don't try to teach him how to do it, or he'll kick you out of his office right away. This video is intended for manual therapists. If you're not a manual therapist, please be aware of that. You shouldn't have watched it and should have stopped it right away.